Hello and welcome to Conversations with Dr. Westman. Today's episode 10, and we're going to be chatting about, is a low-carb diet for everyone? How are you doing, Eric?
Doing well. How are you, Glenn?
Very good, thank you. So I guess the big question is a low-carb diet for everyone?
Well, that's a great question. I mean, maybe is the answer, although it's more nuanced than that, maybe not. Uh, so what do I mean by that? 20 years ago, before we were really studying a low-carb keto diet, everyone thought that the low-carb, high-fat diet was bad and was for nobody. So in my career, the last 20 years, with the research that has been done, there's been a lot of new information about what happens when you keep the carbohydrates low and you do a low carb and even keto kind of diet. And it turns out that it's a healthy thing to do. So in fact, it's therapeutic to do. It can fix diabetes, obesity, overweight, pre-diabetes, high blood pressure, all these different things. So I guess I've seen the needle, so to speak, or pendulum swing from everyone knew it was bad to now there are those who say everyone should do it. The pendulum usually swings really far. And I'm not quite convinced yet that everyone needs to do it. And that's going to be the subject of our upcoming book that we're working on. But I think everyone can do a low-carb keto diet safely and in a healthy manner, which is like a 180-degree turn from when I started in this area with research and clinical use of a low-carb diet now over the last 20 years.
So for folks that are insulin resistant, have type 2 diabetes, metabolic syndrome, would you say that this is the perfect and the right choice for them?
Well, I think so. And, I have to acknowledge that there are many ways of changing the lifestyle in a beneficial way. We think the common denominator is lowering the sugar intake and lowering the insulin rise after the meals. And those go pretty much hand in hand. So you can do a low calorie, low fat diet to fix these metabolic problems. But when you look at different lifestyle changes, the low carb diet, I think, is superior because the hunger goes away after just a day or two. So you're not fraught with having hunger when you're trying to change your lifestyle. And then you get to eat luscious, delicious foods as well. Real food, not fake food. And, everyone probably remembers the rice cakes and all of these bizarre processed foods that are low in fat, but they're not really very healthy. So I think as a target, the preferred diet for someone with diabetes, insulin resistance, metabolic syndrome, which is the high triglyceride, low HDL, or if someone just prefers to eat low carb foods, that would be the preferred lifestyle, a low carb or keto kind of diet.
And you've been doing this for 14, 15 years in your clinic. I mean, you've probably seen over 10,000 people, and that's what you've been doing. You've been restricting the carbs to under 20 grams of total carbs per day. It's been your method. A lot of people go on the net carbs, you go on the total carbs. It's tried and tested, and you see outstanding results every single day over the last 15, 20 years.
That's right. And so our contribution to the medical literature was Dr. Yancey and I at Duke was to put these studies formalize the clinical use of low carb diet. So we visited several doctors that used the low carb diet, but did the research studies and published them in peer-reviewed journals going back to, gosh, I mean, time flies. Our first paper was published in 2002. So Dr. Yancey and I at Duke, and then Dr. Jeff Volek and Steve Finney at UConn, now Ohio State, also doing research independently of us. We've been doing this now for 20 years in research and 15 years in a clinical setting at Duke, so in a university private practice. And I will treat people with lots of different illnesses. I mean, I'm an internal medicine specialist by training, so I understand how to deal with diabetes, high blood pressure, heart failure, all these different issues. And I apply that using a keto kind of diet, and I see pretty much all of these things get better. So in a clinical practice, and the clinical research is validating the use of a low carb diet as a therapy, so as a therapeutic diet. And I think if there's a consensus change, the people who followed the research, the researchers and clinical leaders, understand that this can be a effective therapeutic tool. Not everyone agrees everyone should do this diet. So that's where we are. Should everyone do this diet? So that's my experience is using it as a therapeutic tool. But as I found people getting better, if you've not eaten carbs for 2 years, your diabetes is gone, you're not taking insulin anymore, your blood pressure is normal, you're not taking blood pressure medicine. Most patients are asking themselves, do I ever really need to eat carbohydrates again? Because I feel so good, I'm not eating carbs, I fixed all my medical problems. And so I'm at that position with a lot of people where I honestly just say, I don't know if this is the best thing to continue forever, but it might be. So I continue to measure all of the metabolic parameters that we would normally measure as doctors, and looking at the carotid, the neck aorta, neck artery, aorta, which is the artery in the stomach, and looking at the heart. If these things are looking good, I'm concluding in these people, they've fixed all of these metabolic problems. They don't really need to go back to eat carbohydrate. But I'm honest about, I don't really know. We don't have studies beyond 2 years or so following people. But I'm afraid we don't have great data on any diet beyond 2 or 3 years. But that, again, that's a huge shift from 20 years ago, and we were all taught that this was bad, and now it's potentially better than other approaches.
So why do you think some people are affected by carbs and others are not?
Yeah, I think the theme of metabolic flexibility, or how your metabolism is affected by the food, is an important one. So we summarize that, or put it into a term called metabolic flexibility, or carbohydrate intolerance, or insulin resistance. These are all really kind of the same concepts. And that is your genetics, we believe. So it's your heritage, that if you're someone who has stored energy really well, so you've been heavy all your life, your parents put you on a diet when you were 10, you probably have carbohydrate intolerance or insulin resistance. And the reason some people can eat more carbs and others can't is this response to the food. So if the blood sugar goes up a lot, the insulin goes up, and you store the energy really well, and you do that day after day, 3 to 6 times a day, that is where the problem comes in. So it has to do with your genetics, although you can figure out in your own history, if you've had a weight problem all your life, then this is really a carbohydrate problem all your life. If you're coming into this, you're someone recently, he's 60 years old, he just lost 20 pounds, he never had a weight problem all his life, he's active, he probably doesn't have to maintain the carbohydrate level really, really low, like people who have carbohydrate intolerance.
And so for people that you do treat in your clinic, will the keto or low carb diet work for everyone?
Well, depending on what they're trying to, what do you mean by work?
So if they're presenting with insulin resistance and metabolic syndrome and type 2 diabetes and obesity, I guess the question is, have you ever seen that in your 15 years that you've put someone on this diet and it didn't work?
Well, so as long as you're doing it right, so that's an important issue, there's a lot of confusion on how to do it now on the internet. And so what I'll explain is that if with the approach that we have, we've used it in research studies. We actually borrowed it from doctors that had used it for 30 years in a clinic. So we were the ones to validate the research and publish the research. I will say to someone that this will work like a prescription drug if you do it. So I try to take away the concern about whether it will work or not, because
Right.
the studies have been done that basically, like a prescription drug, this antibiotic will fix your infection. So I don't want someone to be, well, do I take this pill? Do I buy the, so it will work. And I think, yes, there are some and maybe 1 in 100 people that it doesn't work automatically for. And it may have to do with exercising too much, which again goes against everything we've been taught. So there are actually things we think are good and they're not. And with those people, I have to work with them and try to figure out what it is. Sometimes it's a medication that's interfering with the change. But I would have to say that just about everyone has results if you're doing it right. But like any program, there are some folks who you're just never really sure. I don't lock people up in a hospital room and monitor everything that happens. So we have the ketones to measure in the breath, the blood, the urine, which is helpful to troubleshoot if things aren't working well. And that's unique in just about every other kind of program. We can actually measure a biologic variable or biologic ketone to see if the carbs are sufficiently low. But I would have to say the most, the hardest thing to get people to break is to not eat so much and so frequently. We've grown up in an era where food was just so available and it's great food, so it tastes great. And so I do a lot of behavioral work to remind people that they don't have to eat if they're not hungry. They don't have to have breakfast in the morning if they're not hungry. So it's a lot of these behavioral things that can make it not work automatically as well.
And so for some of the people that you treat, once they've reached their goals, let's say that they've followed your advice to the letter, they've reached all their goals, they're off their medications, they are at their normal weight now. Are these people able to increase their carbs slightly?
Many can, yeah. So in the weight loss world, we call it a maintenance phase. So you've lost the weight or achieved your goal, metabolic diabetes is gone, metabolic syndrome, high blood pressure is gone. How do you maintain these results? And a maintenance phase can be done in many different ways. You can find out every day how many carbs you can eat. This is called the carbohydrate threshold or the ketone threshold. You can also just stay strictly keto, not really. This is kind of how I do maintenance. I don't eat many carbs day to day. I just stay very low. You get comfortable with a certain set of foods, and I'm not tugged by all of the different carbs that most people are, because I've been doing this for 20 years. So it takes a year or two going through the holidays, and it took me 10 years to give up jelly beans on Easter, which was a trigger food for me. Put a bag of jelly beans and these sugar bombs in front of me, I'll eat the whole bag. So some people can go back to eating more carbs. Others don't, because they fear that it'll knock them off, and then like an addictive drug like smoking again, they'll just go back to eating more and more and more. So it's an individual decision. If someone's just starting out, they're worried, and I see the worried face of, you mean I'll never be able to have fruit again? I say, no, don't worry. I'm teaching you a method to get to your goal. We could use medicines, you could use surgery, but all we're doing is changing the food. When you get to your goal, we'll reevaluate what you want to do. Do you want to reintroduce carbs again? Sure, you can have fruit again. But if you go back to the way that you were eating that got you there, with the higher weight or metabolic problem in the first place, that's not good. So fortunately, most people learn along the way, gee, it's not the fat in the food that's the problem. It is the sugar. And I know at first it doesn't make sense. And, the blank stares that I get, I just wait, try it for a day, the hunger is gone, or maybe 2 days for the hunger to be gone. The weight comes down after a day or two. It's surprising for a lot of people because it goes against what we were taught, but it really does work if you do it right. So yeah, I would say this will work pretty much for everyone.
Let's go to a couple of questions. I've got a
Not that
question.
that means everyone needs to do it, right? I mean, I hope we're making that clear, that just because it will work for everyone doesn't mean everyone has to do it.
100%.
Right.
Yep.
Yeah.
Laurie says, I'm healthy with no excess weight to lose and no metabolic illnesses. Do I need to be on a low carb diet? Kind of answered this one already.
Yeah, so, I just see a low carb diet as a healthy way of eating. It's not bizarre when you look at the hunter-gatherer, paleo kind of concepts. Humans really didn't eat many carbs until very recently, evolutionarily speaking. And so children can do this. Children are born in ketosis, which is, shocking for a lot of people. But so you don't have to do it. I guess it might cause trouble if you enter today into the keto world. You'll find these kind of bizarre keto products. Now, of course, ADAPT products, it's very clean. We don't add in oils for no reason, but that's what I'm seeing. There are these kind of keto products that you'll try them and you'll think, oh, I got stomach ache. That's what keto is. And no, we want you to understand that eating real food is the keto diet. The ketones come from your body fat. But I see this really, this could be a hunger management control thing to do for your lifestyle. If you have hunger all the time, or it can actually fix migraine headaches, heartburn, all these things that you may not know are from the carbohydrates. It's interesting. A lot of people do continue the low carb diet just because they feel better. They have more energy, less brain fog, more focus. So don't be dissuaded, or don't fear trying it. If you don't want to lose weight, you won't lose weight. Whittle it away to nothing. Your hunger will make you eat.
Right.
Yeah.
Got another one from Martin, and he says, I lead a very active lifestyle. Wonder if I need to limit the carbs to 20 grams total per day or under. I have a few pounds to lose, but no medical issues at all. So I guess he's asking, does he need to be strict at 20 grams total carbs, no medical problems, couple of pounds to lose?
Probably not. And so what we're learning is that the younger you are, the more active you are, the less postmenopausal you are, meaning you don't have the hormonal changes of menopause, the more carbs you can eat and still be in ketosis or still maintain a certain body weight. So a lot of people will change the carbs. So the method to use is modulating or changing the total carbohydrate in the food. You set a level and follow that for at least a few weeks, so your body can adapt to that. Some people notice their ability to exercise improves even if you're in the keto level. Even the story of these elite athletes who are winning races in record time can actually do better at a keto level. For the kind of weekend warrior, you're not trying to win world records. Having more carbs, say in the 20 to 50 or 50 to 75 or 75 to 100 gram range, knowing that these are coming from real foods, not sugar, not junk foods, the highly processed sugar and fat things that are out there, you can actually probably have more carbs. And some people feel better when they're exercising if they do have a little more carbs. And so I can't go against that scientifically at the moment. There's no science or studies that says, no, just suck it up and feel worse when you're exercising because you'll live longer. That's kind of getting into the, I'm a zealot keto, it fixes everything, you got to be very strict world, which I'm not in.
Awesome, Eric. Well, thank you very much for all the insights today, and I hope we've helped answer some of your questions, or some of our viewers' questions, should I say. If you've enjoyed this video and would like to see future videos, you can find us on YouTube and Facebook, Instagram and Twitter under the name of Adapt Your Life. If you've subscribed to our YouTube channel, please hit the notification bell up above so that you can be alerted the next time we post one of our videos. And if you found that the video was helpful and you enjoyed the video, if you would please like and share it, it would mean the absolute world to us. So next week, we will be discussing, do calories matter? So join us next Wednesday for another episode with Conversations with Dr. Westman. Eric, thank you so much for your time again today. Thank you.
Thank you, Glenn.
Thank you.